Good morning, everyone. Please take your seats. We're going to begin our program. Good morning and welcome. I'm Sarakshi, SVP of Programming at The Hill. Thank you to everyone joining us online and in the room for our event today, Trust in Science, the high-stakes game for U.S. public health. I'd like to thank our sponsors, Alliance for Aging Research, for their support of this discussion. As health misinformation continues to spread, America's overall trust in medical science continues to be lower than before the pandemic, according to a recent Pew Research Center study. It is no surprise then that as misinformation fueled ongoing vaccine hesitancy in 2024, whooping cough and measles outbreaks surged 4 times higher than the year before. Public health has more than a public relations problem. The consequences are deadly. What damage has already been done and what challenges lie ahead? Before we get underway, a few housekeeping notes. If you're here with us in the room, please turn your phones to silent. You're welcome to follow the program on social media. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag HillHealth. And with that, I will hand over our announcer to introduce our first segment. Thank you.
Thank you, Sarah. We will begin the program today with our sponsor segment. Please welcome to the stage Sue Peschin, President and CEO of the Alliance for Aging Research, in conversation with Sarakshi, Director of Audience Development at The Hill.
Nope.
Just adjusting. Good morning, everyone. Thanks so much for being here with me. And thank you so much for being here with me, Sue. A pleasure to have you on stage.
Thanks for having us.
So getting right into it, since we only have 10 minutes with Sue here today. So why today's topic? What does trust in science really mean to you?
Yeah, well, so our organization's mission is really about changing the narrative to achieve healthy aging and equitable access to care. But right now, we all seem to be following different narratives, depending on where we consume our information. And it's really the deep divisions that have occurred as a result of that concern us. To be clear, it really has nothing to do with asking questions, because that's what science is. It's really about losing our collective agreement on who's considered an expert and who's worthy of our trust. Social media, politics, and the competing forces in healthcare have really grabbed our attention with a constant barrage of conflicting information, and it's hard to figure out how to reconcile it. The decline of trust in the federal agencies especially concerns us. There's really brilliant and very good people at the National Institutes of Health, the FDA, and the CDC, as well as other health agencies. And we should value and support their expertise because they help keep us and our families safe every day in big and in small ways. And if there's an upside to the fact that we have a national problem with trust, it's that we're aware of it. There was a Pew Research Center survey that found about 2 in 3 Americans say it's very important that we raise the level of trust that we have in the federal government. And 58% of Americans also say it's important to raise the level of confidence that we have in each other. And around 9 in 10 think that we can make progress there. 2 of the most mentioned suggestions for changes we can make, and I don't think this will surprise people, are being less partisan with each other and embracing values such as honesty and kindness. And we agree with the American people, so hopefully this is a step in that direction.
Definitely. Now, we know this is round 2 for the Trump administration. In the first administration, the alliance was actively supportive of Operation Warp Speed, not only to develop vaccines, but also therapeutics against COVID-19. Why was the alliance so supportive, and how would you like to see the second Trump administration build on their previous successes?
Yeah, I mean, Operation Warp Speed was one of the greatest public health achievements in modern time. No vaccine in history had been developed in under 4 years, and many believed that a coronavirus vaccine could take as long as a decade. But President Trump's administration did the impossible, and they produced multiple safe, effective, and life-saving vaccines in under a year. And the National Institutes of Health estimates that Warp Speed saved 140,000 lives in the first 5 months of vaccine distribution. So we wholeheartedly supported Operation Warp Speed because older adults were, and they still are, at highest risk of hospitalization and death from COVID. In fact, more than 81% of COVID deaths in the US have been among older adults. We partnered with Operation Warp Speed to encourage older adult participation in clinical trials. We also worked with the FDA and CDC as they moved through their recommendation process. What was also remarkable was how the last Trump administration slashed through regulatory red tape. They forged historic partnerships with the private sector, and they harnessed the resources of the federal government, particularly at HHS and the Department of Defense. So we need to take the lessons learned from Operation Warp Speed and apply it to future pandemic preparedness and response.
And your organization has worked to combat both misinformation and disinformation. So how can we know who to trust and what information is reliable?
Yeah, it's a good question. So the Alliance is part of the Coalition for Trust in Health and Science, which has more than 90 nonprofit members. The American Public Health Association is speaking here today, and I know there are a number of groups here and probably watching that are a part of it. And the coalition's mission is to rebuild trust and combat misinformation for the good of the nation's health. And they have a lot of good materials, including tips for consumers on how to navigate trusted health information. And folks can check them out at trustinhealthandscience.org. Something that I think they explain really well is that human beings have been spreading misinformation really since we began communicating with one another. So it's not a new phenomenon, right? Anybody who loves gossip. It's our ability to amplify that misinformation on a really large scale so quickly and repeatedly that we have to grapple with today. Now, in terms of where folks can go to for trusted information, the National Institute on Aging, which is part of the National Institutes of Health, is a great place to start. And they're at nih.nia.gov. And in their Healthy Aging section, they have a really good webpage called How to Find Reliable Health Information Online. And the Centers for Disease Control and Prevention website at cdc.gov is another really good place to go. But I want to say something that we think is really important, which is no online information, even if it's accurate and trustworthy, should replace seeing a healthcare professional who can thoroughly evaluate you or your loved one and provide specific advice. So please discuss what you find online with your doctor before making any changes in your healthcare.
And lastly, how does your work address issues of personal freedom and autonomy in healthcare decision-making? Do you see these as opposing issues, or can a person exercise their right to freedom and autonomy while also protecting their neighbors?
Yeah, I mean, this issue really hits home for us as an organization that's focused on aging, because the way that a lot of people speak to and treat older adults is often ridiculous when it isn't downright insulting. So two of our values as an organization are dignity and empowerment. With dignity, we believe everybody deserves to be respected and appreciated for their unique humanity and their inherent value regardless of their age. And in terms of empowerment, we aim to provide older patients and family caregivers with evidence-based information, and that will help them make informed, independent choices that allow them to self-advocate and improve their health outcomes. So we don't see freedom and autonomy being at odds with public health at all. We see public health as integral to freedom and to our democracy. The thing is, I think everybody gets defensive. You know, it's natural, and we shut down when we're treated like we're incapable of making our own decisions. But when it comes down to it, we generally all care about the same things: the health and well-being of our families and our neighbors. So we need to find our center again, and that's why we're here.
Well, thank you so much for that, Sue. That was great insight, and I hope you guys all learned something from that exchange. I'm going to hand it over now to continue with the programming for today.
Thank you.
Thank you to Alliance for Aging Research for sponsoring today's program. Now please welcome to the stage our moderator, Steve Scully, a contributing editor at The Hill, in conversation with former Congressman Dr. Larry Bucshon, a physician and now a senior policy advisor at Holland & Knight. He was vice chair of the House Energy and Commerce Subcommittee on Health during his time in Congress. Welcome.
Thank you all. Sue, thank you very much for that insight. How's retirement?
Day 4. Yeah, so it's good. You know, I was in Congress for 14 years. It's an honor and a privilege to serve. And I think we made some progress in healthcare and other issues with some of my input. So I'm pleased to now be in retirement from Congress, but not retirement from public policy, and being engaged in issues that I feel are important to me, and I'm going to continue to do that.
So as we can see from all the security around here, in just a couple of days, right over there, Donald Trump will take the oath of office. How do you think, in terms of policy, with Republicans, a very narrow majority in the House, a 3-seat majority in the Senate, and of course the White House, will affect public health issues?
I think in a positive way. I think you saw at the end of the last Congress where we had this large funding bill, and there was a lot of bipartisan healthcare pieces of legislation that were in there, and those were agreed to in a bipartisan way. Unfortunately, because of the funding situation and the size of the legislation, all of those got dropped out. So I think you'll see, particularly on the Energy and Commerce Committee where I served, and on Ways and Means that do most of the healthcare, a concerted effort to really bring back a lot of the bipartisan issues that will advance the ball down the field. I think that'll happen fairly soon, and I think the administration will be supportive of most of those things. Public health, obviously, is really critically important. I think we need to do more coordinating between state public health departments and the federal government, and I know that became a difficult issue during the pandemic, but I think you're going to see some good bipartisan work there, and the Congress will drive that. Anything big that happens in the House particularly is going to take some bipartisan work because of the narrow majority.
So on these issues, what I hear you saying, because we all get caught up in the personalities and the he said this, she said that, but what you're saying is that there's a lot more comedy, COMITY, than the attention is getting by the press.
Yeah, oh, absolutely. Behind the scenes, particularly amongst the physicians, and I think Dr. Schrier is going to be on next after this, and you'll see that. But I worked a lot with Dr. Barra, Dr. Ruiz, Dr. Schrier, and others on issues that are important in public health. I think there's a lot of common ground. And so behind the scenes, not only the physicians, but other people interested in healthcare policy will be pushing to make some progress. So I think that's right. I think, on issues that are really important in healthcare that we need to address, there's a lot more common ground than you would think.
So you told thehill.com, which by the way is a terrific publication, last fall, that when it comes to vaccines and public health, these are your words, we need to get to a normal place.
Yes.
So what do you mean?
Well, I think, let me just say this. During the pandemic, the doctors in the Congress did a lot of public service announcements, PSAs, promoting getting vaccinated with the COVID vaccine. And that was bipartisan. We did ones with our white coats on, we did ones without our white coats on, and we worked to influence our colleagues on Capitol Hill in a bipartisan way to make that happen. And I think it was pretty effective. So what happened is, though, is particularly the COVID vaccine, as you know, became politicized, and then you started to see a lot of social media information that was not accurate. And we did our best as doctors on both sides of the aisle to counteract that. But as you probably all know, not a lot of people out there trust the federal government in many respects. And so we tried to do these things as physicians, and we had some success. So what I mean by getting back to normal is we need to get back to data, facts, science, and depoliticize some of the medical issues that I think were politicized, unfortunately.
But here's part of the problem. And your district is a more rural district, and when I travel back home to Pennsylvania and talk to family members who live in smaller communities, they're not believing Washington. They're not believing vaccines. There was a study that about 200,000 deaths during COVID attributed to social media because they felt that the vaccine was ineffective and could kill them. So how do you break through that?
Yeah, I think that's probably right. I mean, I represent a rural area of Indiana, and I can tell you, going around and talking to people, there were a lot of people who were very resistant to getting vaccinated. But primarily, I think because of the influence of social media and other information out there. And I said this recently in another interview that every medical therapy out there, no matter what it is, some people are going to have negative reactions to it. You know, if you look at the FDA would have a hard time approving aspirin today. Okay, if you went back and you looked at all the things that can happen if you just take an aspirin, and that's surprising. But if you go back and look, you'd find that that's true. So I think that's our problem. You know, the information needs to be depoliticized, as I said, and we need to figure out a way to better message to the American people. And one of the best ways, the Doctors Caucus tried to do this, is through the local medical people. You know, we're doctors in Congress, but we have to have the medical people at the grassroots level, you know, the local medical societies and others, carrying these messages, because when you try to carry it top down, it doesn't necessarily get through, and we learned that. So I don't know if that answered your question, but I think we need to get back to that, and I think will happen. I think that will happen.
Sue was talking about Operation Warp Speed, and I had done an interview with President George W. Bush. He read a book about the 1917 pandemic and realized back in 2005, 2006, the U.S. was not prepared for ultimately what came with COVID-19. So my question is, when it comes to Bush, Obama, Trump, and Biden, how collectively among Democratic and Republican administrations Operation Warp Speed came together and the lessons it has for the next time, hopefully not soon, something like this happens?
Yeah, I think there's a lot of consistency at agencies. I mean, people are surprised. I mean, like, you know, if you look at FDA and other agencies, most of the people there are career people. You know, you have the political appointees, and I think there's been a lot of consistency across. If you look at the Trump administration at the end, it was just commented on Operation Warp Speed and Secretary Azar and others. A lot of that groundwork has been worked on for decades, right? I mean, the mRNA vaccine concept was there. They just harnessed that in a way that could speed up the process. So I think there's been a lot of consistency, and there still will be. Will there be political differences when you have new political appointees at agencies? Yes. But you know, I did a lot myself trying to help in my district tell people that, look, the CDC has been and the FDA were pretty maligned during this whole process. But the CDC is still, in most people's minds around the world, the preeminent institution as it relates to what they do. And I think that's what I think you'll see. So I think you're going to continue to see some consistency because most of the people are career people. You'll see some political differences, but you'll see the lessons learned during Operation Warp Speed, and then continued on as it was fully implemented during the vaccination during the Biden administration as they moved through the first couple of years of that administration. Dr. Ruiz and I, for example, Raul Ruiz from California, have legislation on improving clinical trials. That was another issue, right? We had, you know, some of the criticism of the COVID vaccine was, okay, we had these clinical trials, but it didn't, the participants didn't particularly look like America, so to speak, right? And that was an issue initially, for example, in the African American population. You know, there was some concern there about were these things tested on more broadly. So Dr. Ruiz and we didn't get across the finish line, but we really, I believe really strongly that we need to work on our clinical trials. And if you improve that, so everybody out there knows, hey, this was tried on a broad spectrum of people all across ethnic and racial boundaries, and here's the data, I think you'll get more buy-in. And I think that was one of the challenges that we had. It's very complicated. I think let me just comment on data. again, I talked to Dr. Walensky and Dr. Cohen, who are the CDC directors over the Biden administration. And I had legislation actually to try to improve the coordination between state public health agencies and the CDC, and it became very politicized as a database. But we need to do better in communication from, as I mentioned, from the grassroots level in a de-identified way so that people don't feel like their privacy. You know, we've been doing this in science forever, right? Every study you read in a magazine, all the people that participate in the, you don't see people's names written in there about who participated in the study publicly. But I think data acquisition and data accumulation and evaluation needs dramatically improved in the public health space, because if we don't have good data, then we can't make good decisions.
So I'm going to come back to that in a moment and talk about the politics of what we're about to undertake with the debate over the nominee for HHS. But I'm curious, you saved lives. You're a surgeon.
Yeah.
You come to Washington 14 years ago, 15 years ago, as one of 435 members of Congress. And I'm curious, what surprised you the most about how that place works based on your own experience as a doctor, a surgeon, a physician?
Yeah. So people ask me that question. What's the biggest surprise when you came to Congress? And many of you won't be surprised by this answer. The amount of quality individuals who are actually members of Congress on both sides of the aisle. People, I think if and people are surprised when you say that
They are.
in your district. They'll be like, really? That's not what we see on TV. But look at the resumes of some of the people on both sides of the aisle in Congress. Are there people, on both sides that, you would say, well, maybe not. But the reality is that was the thing. I think we need to regain the trust in all of our institutions in this country, not only science, not only law enforcement, the government and other things, and realize that, look, yes, there will be issues, but most people in Congress that I know on both sides of the aisle are here trying to do their version of the right thing. You may not agree with their version, but that doesn't mean they're poorly motivated, right? Does that make sense? Mm-hmm. Their motivations are to help the people they represent, to help the country. You may disagree with how they're trying to get there, but I never, when I was in Congress, tried to figure out what motivates people or say, well, they're misinformed or they just don't understand or this or that, or they're not intelligent, just because you disagree with what they're trying to do. I never did that. I always tried to figure out, okay, how can we find common ground here? Because everybody in this country sees things differently, and we have to come together.
So that's a perfect segue to my next question, which is, as Barack Obama said, elections have consequences.
They do.
And every president has the right to nominate the people that he, someday, hopefully she, will be able to put into his or her cabinet. But there is a lot of debate about Robert F. Kennedy Jr., his background, his comments, his experience. If you were Senator Larry Bucshon and you were asking him questions, what would you ask him?
Well, I'm probably not going to get into that. I mean, I think I'll leave that up to my Senate colleagues.
Oh, come on.
No.
You're
I think,
among friends.
Well, yeah, among friends. Well, who said that in Washington? If you want a friend in Washington, you get a dog. I mean,
Harry Truman.
Yeah, I get it. No, I'm just kidding, kind of.
So you're
right?
calling me a dog?
No. No, I don't want to comment directly on nominees. I think that's the nomination process goes to the U.S. through the U.S. Senate. There'll be, there's an FBA background check. There's going to be questions asked by U.S. senators, and I'm going to wait for that and see. I think I don't think it's fair to nominees, regardless of who it is, for me to comment on that before they've had a chance to make their case in front of the U.S. Senate. And we'll see where that goes.
But if RFK Jr. were here today, having interviewed him on a number of occasions, I think what he would say legitimately is we need to look at things differently. His Make America Healthy Again. So how would you look at things differently when it comes to vaccines, public health, and the role of HHS in Washington?
Let me just say this, and I'm not going to comment on what he might do, but we needed to do, and Congressman Wenstrup, who also retired, Brad Wenstrup, who was from Ohio, and I said this, he led on this. We need to make people healthier, and we need to focus on health and people being healthy rather than focusing on when people are unhealthy, how do we treat them? The big public health challenge I think you have in the United States is we've not done well on funding preventive care, for example. We need to create some alternative payment models on how we fund everyday health care, and make people healthier. A lot of people have said this over the years, but if people are healthy, number one, that's good for them and their family. Number two, it's more productive for society. People are back in the workforce. As a society, you're just better off. And it saves money, right? The healthcare system, I was a tertiary care doctor. I was a heart surgeon. I always used to tell people, when you're talking to me, it's too late. It's kind of at the end of the road, right? Not that we couldn't do anything for you, but the time to really address their coronary artery disease was when they were in their 20s and 30s, maybe, when they started to have diabetes issues, when their blood pressure was high, when the things. That's what I see as how we advance healthcare in the U.S. And public health's a big part of that. You have to have ground level data so that policymakers can make decisions to improve the way that we make people healthy. And if we can do that, it saves money. The discussion in D.C. is always about, okay, how do we pay for it and who pays for it? We need to change that, in my view. We need to change that to, why is it costing us so much money, right, in the first place? Why is the bill really big, and why are we trying to figure out how to pay bills? We need to look at the other direction and say, okay, if we make people healthier, it will decrease the cost. And then the discussion about how we pay for it, who pays for it, will soften.
Okay, so let me take that one step further. What's your advice to those involved in this debate, alliances like our sponsor here today, the political leaders who will lead the discussion and the debate, and the civil service employees in all of these agencies that will help navigate the challenges ahead? Your recommendation is what?
I mean, be more engaged as ever. I mean, I think advocacy on Capitol Hill actually matters. I mean, I've been trying to get physicians, I told people, well, you don't actually have to run for Congress, if you're a doctor, but you should be engaged with your local political figures, your local public health departments. So, I guess my advice would be is more engagement. Don't be discouraged. It does matter. And you'll find, I think, in the Congress, I'll speak for the House, a lot of people are interested and want to listen, not just medical doctors, on both sides of the aisle. But the other thing, and I think I mentioned this earlier, is Washington and federal policy is kind of one thing, but where you can really, I think, have impact is local and state level public health improvements, right? You look at state to state and their data collection ability, for example, their IT systems were maybe decades behind in some states, and there was no coordination of collecting data. So, I mean, come and advocate in Congress and be vocal, but also try to think of ways to actually come from the bottom up, because ultimately what influences members of Congress is the people they represent. And the American people will drive this. And if you start at the grassroots level, you'll find that members of Congress will be like, oh, I'm hearing this from everybody in my district. My local doctor who runs the Department of Public Health in Evansville, Indiana, it's coming to my office and saying, here, look, we need to do these things. That's how you change it.
So I realize you don't want to get involved in what RFK Jr. may or may not do, assuming he becomes HHS Secretary, but if there is a policy that you think the public or organizations have real concern about, what do they do?
Well, I don't think there will be. I think that it won't get to, and I'll just say this, and I'm not going to comment directly on cabinet secretaries or what they may or may not do. But for example, in Congress, I'll just speak to the Congress. And you all have had some of this experience. There's a lot of ideas in Congress. I mean, people drop legislation on all kinds of things, right? How many of them actually ultimately get publicly aired at a committee hearing or come to the House or Senate floor for a vote? So what I would say is to that is issues that I think that the American people aren't supportive of. That will be clear before actually all of us really know that that's occurring behind the scenes. That's how it works in Congress. Members of Congress will be like, well, it doesn't look like that's something that's supported by a broad spectrum of the American people. So I'm not concerned about it. I think that you'll see consistency across all of these agencies, as I mentioned earlier, because there's political people and there's a lot of career people, and there'll be people that are sub-cabinet level. I think that you'll see in all the agencies, regardless of which administration it is, that are people that have deep experience in that organization, whether it's FDA, CDC, CMS, or others. Generally, sub-cabinet level people who are appointed will be people that have experience in those agencies for the most part, and will be able to advise the cabinet level secretaries about policy. And I think that's what you'll see.
So that's encouraging. One final note, because you're a former member of Congress, a doctor, and when it comes to, has nothing to do with healthcare, but is it Your Excellency in Japan, or what kind of title did you get from the Japanese government?
Well, it was now, and you asked me, now I'm trying to remember, it was
Some high honor.
the Order of the Rising Sun, yeah.
The Order of the Rising Sun.
I think that's what it was. It was really a big honor. I mean, the Emperor, I was co-chair of the study group.
The Emperor?
It comes from the Emperor, yeah. I mean, it starts there. Technically, it's from the Emperor, and then it goes through the legislature, their diet, and gets, they get the Emperor gets recommendations from government level officials, and then they have it's kind of like maybe this isn't like the Presidential Medal of Freedom, right? It's a little step below that. But I was co-chair of the Congressional Study Group on Japan for the former members of Congress organization for many years, and I've been to Japan a lot. And I love the Japanese people, and I love their culture. And I did a lot of work through the embassy here in Washington, D.C., and got to know the ambassadors and the people below them. So they gave me this really great honor.
Congratulations.
Really great honor for my work on behalf of the U.S.-Japanese relationship, which is critical, by the way, critical ally in the Asia Pacific. And that's what it basically was about, is how I've worked to help further build that bond in Congress between our two countries.
Your Eminence, thank you so much.
Yeah, no.
Congressman, thank you.
You're welcome.
Real pleasure. Thank you
Thank
so
you
much.
all.
It was great. Thank you.
Please welcome Representative Kim Schrier, a Democrat from Washington State, pediatrician, and member of the House Energy and Commerce Subcommittee on Health. Welcome, Congresswoman.
Nice to be here. Thanks so much.
Thank you so much.
Are you really the first pediatrician in Congress?
I sure am.
Oh my gosh.
Pediatricians are generally pretty happy in their jobs, so it takes desperate times, real motivation to step out of out of a place where everybody loves you, right? You're taking care of their children, the grandparents love you, to this environment.
You've not gotten a Rising Sun Award, have you?
No. In fact, I don't know how you put energy and commerce together with travel and foreign policy, but that is very cool.
Let's talk about your work, and as you navigate all of the changes about to happen on Monday at noon, and a new cabinet, a majority of the Republicans, a narrow majority in the House, Speaker Johnson, what are your worries?
Well, I've never been in the House in this position of being with the White House, the Senate, and the House all controlled by the same party and not my party. So I'm not completely sure what to expect. We got a little taste a few weeks ago when we voted to fund the government, the continuing resolution until March, where we were able to exercise some significant power, and that unless there is unanimity with my colleagues, my Republican colleagues in the House, we're going to have leverage that can be, I think, quite protective. I mean, this is my perspective because I may not be the same party as half of you. I guess my big concern, and I think my Republican colleagues' big concern as well, is how much of our power will simply be taken away by executive orders, by centralizing everything with the executive branch, and that being enabled by the current Supreme Court. And I think that is what poses the biggest danger, is that we would lose a system of checks and balances.
Supreme Court, healthcare, tie that together.
Well, specifically with the Supreme Court and healthcare, the first thing I think of is the overturning of Roe v. Wade, of course, and taking a decision away from women and their doctors and putting it in the hands of politicians. And then we've seen what's happened across the country when political figures, often in gerrymandered districts that don't represent, I mean, there's no red state that's 100% red, right? Like there's a lot of people there who feel very, and are very, disempowered by the removal of their right to make decisions about their own bodies. And so I fear, again, more power with the executive branch and more political meddling in healthcare. I'm worried about, the FDA and mifepristone too.
You have been on the front lines of healthcare, and so if a parent comes in with a young child and says, I have some real concerns about a vaccine, you tell them what?
Oh my gosh, that happened all the time. I mean, first, this really ticked up in about 2000, when a very fringe doctor in England had like 12 patients, and he just started theorizing that perhaps the MMR vaccine was related to autism. I mean, we're talking about 10 patients. It's not a study. This spread like wildfire. I mean, that spreads like wildfire. The fact that we're preventing thousands of deaths every year from a terrible disease, like nobody hears that pin drop, right? It was total misinformation. I got questions all the time from nervous parents, but here's the thing. Like I said, pediatricians, we're very trusted by our patients. We're there at deliveries often. We coach them through difficult moments, and we sit down and we have a fireside chat where I acknowledge that it can be scary, especially when we live in a time when most people have never seen measles. Today's parents really have never seen chickenpox. Mm-hmm. They haven't seen any.
Which
of
is a good thing.
It is such a blessing, right? So then all parents today can do is look at the risks and not consider the benefits. And so we have a discussion. And I mean, 90% of the time, those kids get vaccinated.
But there is so much misinformation out there. I've said this so often before, that the good news is with the web, there's more news and information out there than ever before. The bad news is there's more disinformation, especially when it comes to public health, especially when it comes to vaccines. How do we break through that? And I guess more importantly, how do we educate parents who have legitimate questions about vaccines and where we are in the health sphere?
Listen, I think it's fine to have questions. Nobody should have an issue with having a question. The problem is when you have people who are intentionally spreading disinformation, things that have already been disproven, and we have potentially a future Secretary of Health and Human Services who's sowing doubts, bringing up questions that have been long settled by massive studies that have disproven Dr. Wakefield in England. So, I've been thinking a lot about this, and it is ultimately going to require the people in this country around the world to become critical thinkers and double checkers. And that, I'm watching my son's education, and they are getting education into looking at sources and double checking things. But most people in this country aren't. And that's why we are seeing conspiracy theories flying, and people believe the scary stuff and don't understand science evolves, and we should be trusting our authorities. It makes me nervous about the replacement of scientists. Like Dr. Bucshon was just talking about people who have been in these agencies for years and studying, they're the experts. If they're replaced by political appointees, you're going to be looking to your own family doctor and your pediatrician for truth, and that's going to be a tough time.
Well, that's sobering to think about. Dr. Bucshon did not want to answer the question, but maybe you will. If you were in the U.S. Senate, if you were on the Health Committee asking questions to RFK Jr., he has said repeatedly that he's not a vaccine denier, he's a skeptic on some vaccines. What questions would you ask him?
Well, I mean, in my mind, that's disqualifying enough. I mean, if you're a skeptic about something that has had study after study already done, that's been proven to save countless lives, that has been shown both in pre-release studies and post-release when we have reporting systems so that either doctors or patients can report if something has happened and they wonder if it might be due to a vaccine. Just sowing that doubt, that is so irresponsible to bring up these questions. I mean, that's why I spent so much time in my clinic answering these questions, is because people out there, Jenny McCarthy, people who have no medical background are sowing doubt, scaring the public. Vaccination rates drop. They don't have to drop much. We had a case of polio in New York not that many years ago. We've seen measles outbreaks when there are pockets of under-immunization. These diseases are around. By the way, when you see one case of paralytic polio, it means there's 100 people who got polio, because only 1 out of 100 about actually show severe symptoms. So these diseases are there. They're waiting to come back. And if you are out there going, I don't know if we should do this, that's disqualifying.
So let's follow up on what Congressman Bucshon was talking about, because there is the ability for Congress to push back on some of these issues. When you talk to your Republican colleagues in the public health debate, in the vaccine debate, what do they tell you?
Oh, well, just go look at any hearing in Congress. I mean, they become very partisan. There were fights over masks. I mean, I don't want to go back to COVID. Well, I'll have a little PTSD over that one. But, I mean, the reality is science advances. We didn't know how it was spread at the beginning. We learned over time. Masks aren't just there to protect you. They're to protect everybody else. And, the fact that that led to such fierce debates was deeply frustrating and unfortunately deeply partisan. So, yeah, there's checks and balances, and there is a lot of bipartisanship in our particular committee, in the Energy and Commerce Committee. But facts are facts, and sometimes I think we just shouldn't have separate staff for each party, that we should have a set of staff, a set of facts that we all operate from, and then I think we would have a whole lot more agreement.
So
sorry for that sobering
Well, no,
comment.
because when you talk about COVID-19, we all lived through this, and it was a public health crisis. To your point, we didn't know a lot. Schools were shut down, businesses were shut down. It has forever changed an entire generation. Why did it become so political?
As I reflect on this, I wished all along that the daily press conference had been kind of like a conversation with your doctor. I'm going to sit down in my white coat. The head of the CDC would be a perfect person. Dr. Fauci would have been a perfect person to do this. A fireside chat with the American public. Here's what we know today. We're going to be learning more. But for now, here's what we're going to ask of you. And the recommendations might change, but let me tell you why we're doing it. Like, to just have a frank conversation and not have chatter countering that sound advice and that trusted for decades advice by a president or by others spreading misinformation. We're also living in a time when people don't want to be told what to do. I mean, if you tried to put seatbelts in cars now, that would become a partisan fight. This is a tough time, and misinformation, disinformation, and kind of a sense of responsibility to our brothers and sisters in this country. I think has faded a bit. And, the reminder that, we love this country and we're founded on helping each other and living together and voting and discussing, I think we did need that reminder last night. It's all of our responsibilities to start looking out for our country and for one another.
I want to come back to the vaccine, in particular the debate for children and for the elderly. But same question I asked Larry Bucshon as a surgeon, and for you as a pediatrician. You spent much of your adult life as a doctor dealing with young kids and families. You come to Washington. What surprised you the most?
Well,
you're smiling.
I mean, I had good surprises and not so good surprises. Like the great surprises, you saw me give Dr. Bucshon a hug. Like, we've worked together a lot. We have so much in common. We speak a common language. The goodness of people in this place and the camaraderie is surprisingly wonderful in many ways that you don't hear about, most of us, because I'm not on your Twitter feed. There's a lot of us like that. You can probably name 10 members of Congress, right? So,
do you want to name them? No, I'm kidding. We all know.
The tough part is that when you get into, whether it's the House floor, into a committee hearing, the Dems are on one side, the Republicans are on the other side, go back and forth. It's not I wanted a roundtable conversation. Like, hey, what do you think about this? Let's bat these ideas around, as opposed to a 5-minute performative question and answer that doesn't really go deeper and deeper and deeper. And I think that is a frustrating part of Congress. I think if we had the roundtable chats and no cameras, we'd do a lot better.
You wrote a bill on childhood vaccines, a new Congress, so what's the status of it?
Well, so there are a couple of vaccine bills that I've done. In fact, when I came in, I was in the class of 2018. 2019, there were measles outbreaks across the country, and so my first bill was really combating vaccine misinformation, at least an attempt to do that. And that ended up getting incorporated into some of the big COVID packages, and boy, did we try. But it's very hard against the blowback of online misinformation. Most recently, I'm trying to expand the Vaccines for Children program. There's a program where children can get vaccinated for free. We all do better when we're all vaccinated. You've heard of herd immunity now, and we want to make sure that getting good health care and the basics of health care shouldn't matter. Your financial status and zip code shouldn't matter. So this is getting more providers to participate in the Vaccines for Children program to get more kids immunized.
This may be out of your wheelhouse, but the story the other day about the explosion of dementia over the next 20 to 30 years, and of course something that this alliance is involved with, just from your perspective. Again, you're a pediatrician, but when you see that, what are your thoughts?
Oh, I am so scared about that. My dad has Alzheimer's.
How's he doing?
Not well. I mean, it is a heartbreaking, like on a personal level, and it's also like, what are we going to do with all of these elderly people who need care and that will bankrupt the country? And I mean, one of the places where we deeply agree is we need more and more research into this disease, into what is going on, into everything we can do to stave this off as long as possible, because it will devastate not just people, partners, and families, but the country.
I'm so sorry. I mean, we've all dealt with this, haven't we?
Yeah, I mean, I think we all have. And
or know people who are dealing with it.
Sure, absolutely. It is so common. We're not dying of massive heart attacks when we're 60 anymore.
So let me close the loop. A final question when it comes to the elderly in vaccines and what we need to do as a country, as a society, Congress, and public health experts.
There's two really vulnerable groups when we think about illness. And And COVID was different in this respect because kids were not, but typically it's children and it's the elderly. And children are also the vectors that give it to everybody else. As anybody with a child or a grandchild knows, you get sick for the first 2 years because they're always snotty and coughing. And so getting kids immunized with the Vaccines for Children program and with getting information out there and having a medical home for every child is critically important for keeping them safe and also for keeping their grandparents safe. And then what we did with the Inflation Reduction Act with not just $35 insulin, not just Medicare negotiating the cost of prescription drugs, but making adult recommended vaccines free for seniors is a really big deal. That shingles vaccine costs about $400, and that will make a senior go, I don't know, because I don't know if this is covered. Now it's free. The pneumococcal vaccine, I actually got my shingles, my pneumococcal, flu, COVID. I got these all done just in the last month and or two, and they're really important. If kids are going to bring home pneumococcus, it'd be nice if the grandparents didn't get pneumonia and sepsis and die. There you go.
Good luck with your dad. Thank you very much. We really appreciate your time, Congresswoman. Thank you.
Thank you so much.
Please
I
come back
appreciate
again.
the conversation.
Nice to meet you. Thank you so much.
Thank you.
Appreciate it.
It is now time for our panel. Please welcome to the stage Dr. Georges C. Benjamin, Executive Director of the American Public
That's a
Health
Congresswoman's
Association,
name.
Lynn Albizo, Chief Public Policy Officer at the Immune Deficiency Foundation, and Imran Ahmed, Founder and CEO of the Center for Countering Digital Hate. Welcome all.
We're moving into Ravens territory right now, just in interest of full disclosure. I think we have 2 Ravens fans here. Doctor, you can sit right next to me.
You want me there?
Yeah, thank you. Thank you all for being with us. We appreciate it. Dr. Benjamin, let me begin with you. What have you learned? You were here for the full panel earlier, 2 members of the House, one former, one current. What's your takeaway?
I think there's an opportunity for collaboration if we can get them to get out in front of, into a private room and away from the television cameras.
But can we do that?
We're going to have to, otherwise we're going to be in big trouble.
What do you think is the big public health debate moving forward as we see a new administration, a new HHS secretary, and a lot of questions looming?
Well, as we heard earlier, I think vaccines are really important. And just in general, all this misinformation that you're hearing. I represent the Immune Deficiency Foundation, and that's for individuals that have primary immunodeficiencies. Those are genetic disorders of the immune system, and they rely upon herd immunity, as you just heard. So they may not build the immunity that others do when they get vaccinated, but they need to have everybody around them vaccinated. And that's true for everyone who's immune compromised, including all the elderly people that we just heard about as well.
But as you know, herd immunity was really part of the looming debate with COVID. What are the lessons from that?
Well, we need to just work. The lessons are that people, we don't want to see the kind of deaths that occurred there. I think by a lot of misinformation that got out there, we need to have we need to be more, secure about what the information is out there that we have that is science-based, but we know that people don't really think about science. They care about how they feel. So it's important that we realize that somebody they know, somebody they care about is probably immune compromised. We know that there's 14 million people that are immune compromised that are under 65. So if we take that and we add all the people over 65, 58 million, we're talking about 1 in 5 people that are at risk when you don't get vaccinated. So it's really important that people kind of see how it affects their own family or the people around them. And I think that's easier to relate to than sending out a lot of information, which is great and we would like, but people don't always relate to science and data. So we have to bring it down to their level.
So let me bring your colleague in the debate, because you've gone head-to-head with Elon Musk. He is going to be on the west front of the Capitol along with Mark Zuckerberg, and there's a big debate on misinformation, disinformation. Specific question, does Congress have a role in trying to regulate some of this information, and what's the role of these social media platforms?
Well, what's the role of the social media platforms? Clearly, they are the primary vector for the disinformation that we're seeing. And the algorithms that decide what content gets shown on those platforms, what gets promoted and what gets demoted, they have absolute control over that mechanism. Think about it this way. Every day, 13 lifetimes worth of content is uploaded to TikTok. 13 lifetimes. So clearly, you're not going to watch it all. Like, yes, anyone can post what they want, but not everyone's going to get seen. They decide what gets seen, right? A few years ago, Mark Zuckerberg put out a chart. Mark Zuckerberg's a very interesting character because he is also a scientist, a mathematician. So he put out a chart which was on the x-axis how violative content is, so how likely it is to break the rules, and on the y-axis was engagement. And it shows that low violative, very low engagement, all the way to the absolute cusp of being violative, and then it shoots up. And that's because when someone says something stupid, we tend to react. When someone says something sensible, we tend to just go, oh, yeah, okay, sure, and do nothing, don't react to it. But because engagement drives amplification on these platforms, he understood that that meant there was a churning effect of the most bananas stuff into the center. The thing that becomes most visible is the most banana stuff. And he said that's why they need to have moderation. That was his argument for having active moderation. Mm-hmm. Now he says quite the opposite. And actually, you know, I'm British, so we have a very keen sense of irony and cynicism. We come from a very grey, rainy country. So, you know, I see a degree of cynicism in what we're talking about here. Now, look, that's the way that platforms work. Should government tell us what to say and think? Clearly not. I mean, people tell me, I'm married to an American, my children are American, I'm a permanent resident here, I've been here for many years. But people tell me that, you know, other countries don't have as much of a reverence for freedom of speech. You do know where John Locke came from, don't you? So we, of course, have a reverence for freedom of speech. We, of course, have a reverence for democracy. I don't think government should tell us what to say or do. I actually want a more informed discourse on how these platforms work. I want to be able to hold them accountable. If a physician told you to take something which caused your child to die, you would sue them. If a platform's algorithms repeatedly tell you something, and such that you believe it to be true, and that causes you significant harm, you should be able to sue them. But you can't. Because there's only one industry in America today that's been given a specific get-out-of-jail-free card by Congress. Section 230 of the Communications Decency Act 1996 means that you can't hold them liable. And so the system of checks and balances is broken down for social media companies. I don't think Elon Musk is an evil man. I don't think Mark Zuckerberg's an evil man. I just think they're doing what they're allowed to do. And we can change what they're allowed to do. We can create checks and balances on them. We can make them subject to the same negligence laws, the gross negligence laws, the knowing indifference laws that we have in place for other companies. And we can mandate transparency. So one of the things that we've been arguing for around the world, I'm going to the UK tomorrow, I think, to go and give evidence to Parliament. I'm going to Brussels shortly. Both of those jurisdictions have created transparency laws so that we understand how the algorithms work, how the advertising work, how their content enforcement works. If you're going to take content down, tell us why. So those are things that Congress can do to have a more informed discourse without having to censor anyone.
And of course, nothing has changed since 1996 in technology when that law was put in place, so we can rest assured that it is still in place today, I say tongue-in-cheek. But that gets to my point with you as a public health expert, because you have really seen the trajectory of misinformation. Walk us through the changes you've seen over the last 30 to 40 years as a public health expert from, the 80s and 90s to where we are in 2025.
Yeah, so in the early 90s, I was the health officer here in Washington, D.C., and our immunization levels were very low, and we passed laws. We passed Vaccine for Children's program to make sure all kids had access to vaccines. And we were able to, regulate and put in place rules that you couldn't go to school unless you got all your shots. And, we didn't get a lot of pushback from that. We were very well below the radar screen. Fast forward to 9/11 and the anthrax letters. When we felt threatened by this powder. I mean, we were chasing powder all over the place. We were checking powdered donuts for what people were concerned that might be, put them at risk. And people were checking their mail. But both sides of the political aisle were very comfortable having reporting laws, requiring people to do things, shutting down things. No big deal. Great consensus, pretty good leadership at the national level. Fast forward to COVID. We had a total breakdown in leadership at the national level in COVID, quite frankly. We did a wonderful job, as you heard earlier, of Operation Warp Speed. We did a good job on the science. We did a terrible job on the implementation. We did not educate the public. We just assumed people knew what a vaccine was. And we had people who gave disinformation, which of course then was magnified by misinformation. And I always ask when somebody gives disinformation, who benefits? Mm-hmm. And quite frankly, there seemed to be a political benefit to giving disinformation, which continues today.
Which has led to the challenges that you're facing with your organization, because trust in all institutions is now at an all-time low. How does that complicate what you're trying to do?
Well, very much so. I can give you an example beyond just the vaccine issue. We have always advocated for universal newborn screening. Individuals with PI, there's a condition called SCID, severe combined immune deficiency, which infants are born almost with no immune system. It's also been known as the boy in the bubble disease. We had advocated for 10 years to get all 50 states to screen for SCID, and now they do, which is great. But the Newborn Screening Saves Lives Act, which was year after year after year reauthorized, the last several years has been not reauthorized. That gives money to the states to do this newborn screening. It can allow all different kinds of conditions to screen for that. So things that used to be just normal, like, yes, everyone agrees, newborn screening helps us identify babies that could die or have serious disabilities, are now being challenged on the basis, people saying they should have the freedom to not get their child tested for these things, which, is really very, the cost benefit is very clear. And the same type of thing with vaccines. So things that the community as a whole have decided are important are now being questioned. And I think it's, the divisiveness in politics, the social media, all these things are contributing to that. And we just, I agree with Dr. Bucshon that we need to get back to normal. We need to work bipartisan lead to, have more information that people can trust in all these areas, because public health is so important.
So I realize, again, going back to your challenges or battles with Elon Musk, how concerned should we be as a society?
For those that don't know about my battles with Elon Musk, we did a study of X when he took over the platform, just a data study to look at the prevalence of hate speech on there. So the most offensive term you can use about black people, the N-word. We looked at the prevalence of anti-LGBTQ plus language, anti-women language, anti-Jewish language. And we found that there was an enormous uptick. There was a 202% increase in use of the N-word on the platform after he took over. Because he said, you can say what you want. And really nasty people thought, well, we will. And that study was on the front page of the New York Times. He claims it led to $100 million of advertising being lost by his platform. And he sued us, not for defamation, not for being wrong, but for the act of doing research itself. He said it broke the terms of service of X to use X to study it rather than, to consume ads all day. And we beat him, of course, because we have a First Amendment right to study a platform and to tell people what we find. I think there's something there that the courts remain a place where truth really matters, right? Mm-hmm. And that's a vital protection, and it will be a vital protection in years to come. One of the observations I'd make, and forgive me, I have to put on my glasses because I'm 46, I'm getting blind. So this is...
That's the new 30, by the way.
Yeah. It's one of my favorite press releases of all time. October the 22nd, 2020. So before the 2020 election. Press release, fact, Joe Biden's, this is from the Trump campaign, Joe Biden's anti-vaccine rhetoric is anti-science and dangerous to public health. And it lists out a number of times when Joe Biden suggests that the coronavirus vaccine won't be real and may not be safe. Biden says the vaccine is not likely to go through all the tests that needs to be and the trials that are needed to be done. Biden asks, who's going to take the shot? Are you going to be the first one to say, sign me up? Kamala Harris says, I think that's going to be an issue, when asked if she would get an approved coronavirus vaccine. Biden says he would only take the vaccine if we know all of what went into it. So
this is pre-COVID.
This is during COVID. This is while COVID was going on. This is in October 2020, and these are all listed out. Now look, the point here is that vaccines aren't a partisan issue and weren't when we started studying it. When we were doing the research that became Disinformation Dozen, the paper that sort of got a lot of attention because it mentioned 12 of the leading anti-vaxxers who produced the content that comprised 2/3 of all content against vaccines shared on social media. Now that was a snapshot study that got a lot of attention at the time. Vaccines should not be a partisan political issue. The question of whether or not vaccines are the most effective, safe, and impactful medical innovation in the last 200 years is a matter of simple fact, not a football for politicians. And the point that I would make is, at this point, I think that we've got to stop having debates over, are people being partisan? Who's doing the disinformation? Is it Donald Trump, or is it Joe Biden, or is it Kamala Harris? We have to deal with the fact that getting away with all of this, sniggering in the background, profiting from all of this, are two primary actors. One is the social media platforms, and the second is an industry that has been set up to undermine public health in America and profit for themselves either politically or economically. And the people that we identified in the Disinformation Dozen study, they have taken countless American lives. I'm 46, from that generation, that 9/11 was the first terrible thing that happened in my life. It was the day before I turned 23. 2,996 people died on that day. I went to an army recruitment center the next year. I ended up going to Cambridge to study politics. I changed my life. I'd been studying medicine. and I went to work in Parliament for several years. In that moment, think about what we did in response to those 2,996 innocent souls taken. 311,000 people died in the pandemic unnecessarily because of disinformation, according to Microsoft AI and Brown School of Public Health. How on earth is it that we have not yet held accountable the people who were responsible for those deaths?
So let me jump in, Dr. Benjamin. Let's take the personalities out of this for just a moment, regardless of who is president, regardless of who was HHS secretary. But how much authority does a secretary have when it comes to vaccines and public health? And if there are policies being put in place that you may disagree with, what are the next steps?
Yeah, we have an enormous system of checks and balances to evaluate early therapeutics, to decide whether they're safe and effective, and to figure out who gets them. The problem with a secretary, and having had that job both at the city level and at the state level, is that they have an enormous bullhorn. People see them because of who they are as the nation's chief health strategist. They assume that they're going to give them authoritative, factual, and truthful information that won't hurt them, but that will improve their health. So people start with anything they say that they're believable. So they have an enormous bullhorn. So they can influence a lot. Now, the federal government, public health is managed at the local level, at the state and local level. That's where the laws really are manifest. But the national government provides enormous steering of those guidelines. And they can influence a lot.
So what you're saying, you can jump in on this, is because we've heard this so often, people seem to gravitate to those sources of information that reinforce their own point of view, and so that they will use that as an excuse or reason to do something or not do something.
Sure. I definitely think in terms of the bullhorn and the leaders in the federal government are the ones that have the influence. So people are going to look toward now, because we're so divided, people are going to look to what leaders are going to reinforce what they already think. So it's important. We've always in the past had the public health agencies, CDC, the FDA, all those were things that people trusted regardless of whether you were a Republican or a Democrat. But there's so much skepticism now in the federal government that people get, it gets very partisan all the time. And I think, we need to get back to the point where the agencies are trusted regardless of who is on the top. But it becomes very hard when you're appointing leaders that are known to be very divisive.
So based on that, Dr. Benjamin, what worries you the most? What keeps you up at night?
Yeah, what keeps me up at night is making sure that we can reestablish trust, and that we get people, policy is people, or people are policy. And so we want to make sure that the people that are in these jobs, that are nominated for these jobs, are well-trained, have the proper administrative capacity, and have the judgment to do the jobs. And so I think that's the test of what any elected leader ought to use when they're picking people for those jobs.
For your organization and for the Alliance on Aging Research, what are your marching orders? What are your recommendations? What are you doing specifically?
Well, we've put out a statement on our website, and we also sent letters to the Senate committees just emphasizing the importance of vaccines, the importance of public health for the HHS secretary to embrace. I think we've seen in the news, we've seen the history of the appointees at this point where it makes you question whether or not they would support vaccines and public health. So we're making our voice heard. It's not about Republican or Democrat, but it's about supporting science, supporting public health, and protecting our communities. because people who are, we represent, in addition to the Immune Deficiency Foundation, there's an Immunocompromised Collaborative, which is all different organizations that represent groups of people that are immunocompromised, like people with cancer, people with, that need organ transplants, AIDS, lymphomas, and all kinds of autoimmune diseases. And all these different groups are very, are at risk. So we need to have leaders that are going to support basic public health and basic truth.
A good complication, Dr. Benjamin, to all of this is that we're living longer, we're living healthier, but also as we get older, that presents a whole new set of problems in this debate, doesn't it?
No, it absolutely does. And I think we've got to recognize that, we just had a president who died at the age of 100, and I'm trying to beat his record.
Good for you.
But the challenge we have is that as we get older, the spectrum of disease changes, so that our bodies fail differently. So we become more susceptible to a range of infectious diseases as our immune systems fail. We're on more medications, we get more chronic diseases. Those change our risk factor. And so we really need to begin thinking about health collectively across the lifespan, much differently than we've thought about in the past.
And so let me conclude with all of your comments. There are just so many layers, and you outlined so eloquently the political and media challenges that we're facing in our society, and you outlined the health challenges. So let me just give each of you a moment to kind of give this audience, you heard the two members of Congress, your own takeaways and what you think the challenges are moving forward. We'll begin with you.
Trust is important, and I think we've got to figure out how do a better job of bringing people into the conversation. The good news is that we had, for the first time, a national conversation around health, which we used to have quietly in the back rooms or in private clinician rooms, and we need to figure out how to do that collectively and on a population basis going forward.
I agree with that. I also think all the messaging out there we need to make sure that we get out messages that are positive about true public health issues. We need to battle a lot of the misinformation and get back to normal.
Can we do that? Can we get back to normal?
I hope so. I think that's really an important role that a lot of advocacy organizations have, to let our public officials know that it matters to us, and that people who are immune compromised are at risk when we ignore the science. So we'll be working hard to get that message out there.
Well, thank you for the work that you're doing, and we will give our friend from the UK the final word.
Actually, from Washington, I live in Tacoma Park, so...
That's a whole other country, but that's another story.
It's slightly eccentric. That's why I like it. Look, I'm an optimist. I worry that you're going to ask me what keeps you up at night, because nothing really keeps me up at night. But we're going to have to judge ourselves on what we do, rather than how much we talk and discuss. Lives have been lost. We know what the problem is. Question is, what are we going to do about it? And each of us can play a part in that, whether it is urging our representatives to take action on transparency and accountability, whether it is bolstering our public health advocates by going out there and spreading good information ourselves. But I think that this is a collective endeavor that we're going to have to do. And I am a great believer in America. I love this country. And I know that whatever challenges are put up against it, and I don't think we can go back to the status quo ante, because I think we have fundamentally changed the way that we communicate in our societies. But I know America will be the first place in the world to work out how we can get past that to a better future.
Sir, you are leaving us with a much more optimistic tone. You're optimistic?
Like I say, I'm an optimist.
We will leave it there. Thank you all very, very much. Go Bills. I'm just kidding.
Last week, The Hill's Steve Scully sat down with Dr. Paul Offit, director of the Vaccine Education Center and attending physician with the Division of Infectious Diseases at Children's Hospital of Philadelphia. Dr. Offit is also an author who has written many books about vaccines, infectious disease, and public health, including his latest, Tell Me When It's Over, an insider guide to deciphering COVID myths and navigating our post-pandemic world. Have a listen.
Dr. Offit, thank you so much for joining us. And let me begin with some basics, as the public health debate is very much front and center with the incoming Trump administration. You literally wrote the book when it came to vaccines. Give us a brief primer on the evolution of vaccines and, from your standpoint, their value in America and across the world.
Sure. Well, you can start with the first vaccine, the smallpox vaccine, which was introduced into America in the early 1800s. This was a virus that probably killed 500 million people in the world's history. Because of that vaccine, we've eliminated it from the face of the earth. Because of vaccines, we live 30 years longer than we did 100 years ago. Children no longer have to be paralyzed by polio. At the time that my parents were born in the 1920s, diphtheria was a routine killer of teenagers. Pertussis, or whooping cough, would kill 8,000 to 9,000 children a year. Bacteria like Haemophilus influenza B or pneumococcus or meningococcus were routine causes of meningitis. When I trained in pediatrics in the late 1970s, I would do 3 spinal taps a night when I was on call in the emergency department. Now most pediatricians don't know how to do spinal taps because we've so dramatically reduced the incidence of meningitis. Vaccines have been probably the biggest public health achievement in our lifetime.
And yet, as you know, part of the debate, including autism and other conditions as a result of vaccines. Can you clear up the myth versus the facts when it comes to autism in particular?
Sure. So I was actually on the advisory committee for immunization practices between 1998 and 2004 when a lot of this sort of came to the fore. Initially, the notion, which was brought up by a now discredited researcher in the United Kingdom named Andrew Wakefield, was that the combination measles, mumps, rubella, or MMR vaccine caused autism. And it's perfectly reasonable to ask the question from the parent's standpoint. My child was fine, then they got a vaccine, now they're not fine. Could the vaccine have done it? That's a scientific question that can be answered in a scientific venue and has been answered again and again. There's been more than a dozen studies done in 7 countries on 3 continents involving thousands of children showing you were at no greater risk of getting autism if you got the MMR vaccine or if you didn't. Then the hypothesis shifted to thimerosal, this ethyl mercury containing preservative in vaccines. That's what caused autism. Again, study after study showed you were no more likely to develop autism if you'd gotten vaccines that contain that preservative, or if you've gotten the same vaccines that didn't contain that preservative. So again, we keep beating back this notion that vaccines cause autism, and it's really a shame. I think for parents of children with autism, they've watched the anti-vaccine movement basically take that story hostage, much to the harm, I think, of children with autism. There was recently a study published in the Journal of the American Medical Association finding that children with autism are less likely to be vaccinated than others who don't have autism of the same age, and that their younger siblings who are healthy are also less likely to be vaccinated. So we've unnecessarily scared parents to put their children in harm's way.
So as a doctor, as a public health expert, let me ask you about the COVID-19 vaccine, which I realize has been an evolving vaccine over the years because the virus has changed from 2019 to where we are in 2025. But what were the lessons of Operation Warp Speed, and what can we take away from that as a society?
I think the lesson from the COVID vaccine was that the National Institutes of Health saved our life. People look at that vaccine, the first vaccines, and I'm on the FDA Vaccine Advisory Committee. We met in December of 2020 to discuss the first 2 vaccines, the Pfizer vaccine, the Moderna vaccine, both of which were messenger RNA or mRNA vaccines. We'd never used that strategy to make a vaccine before, and people saw that as new, maybe too new, and were worried about it. But if you look back, when the first coronavirus sort of raised its head in 2002, so-called SARS-1, NIH began working on mRNA vaccines in-house with people like Barney Graham and Kizzy Corbett. So we'd had really 20 years of experience with that kind of vaccine before SARS-CoV-2 hit. And if you look at NIH funding, NIH funded mRNA vaccine research starting in 1997. In fact, the 2 people it funded, Drew Weissman and Katie Corbett, won this year, Drew Weissman and Katie Carico won this year's Nobel Prize in Medicine. So thank you, NIH. Operation Warp Speed was more of a production issue, meaning being $11 billion bet on 6 companies to win one race, and it really dramatically speeded the production process. So both of those things, I think NIH research and the Operation Warp Speed certainly saved our lives.
But here's part of the problem, as you know, we have access to more information now than ever before, and that's a good thing. We also have access to a lot of misinformation on social media, which is fueling part of the debate over vaccines. Your message is what?
My message is that there are systems in place to make sure vaccines are safe and effective. I mean, when we met in December of 2020, we had done 2 large clinical trials. For Pfizer, a 40,000 person trial, for Moderna, a 30,000 person trial, to show that that vaccine was safe and effective. But that was in tens of thousands of people. You don't really know whether it has a rare side effect until the vaccine is given to millions and tens of millions and hundreds of millions of people. But very quickly we found out that the mRNA vaccines were a very rare cause of myocarditis, meaning inflammation of the heart muscle, and that the Johnson & Johnson vaccine, which was introduced in February of 2021, this adenovirus vector vaccine, was a very rare cause of dangerous clotting. It was rare, like 1 in 250,000 people, but it was real. So the point being, we give vaccines to healthy people. So they have to be held to a very high standard of safety, and there are post-marketing systems in place, surveillance systems in place to very quickly find that out.
We're in Washington, D.C., and of course, dealing with this on a national level. You are in Philadelphia. You are dealing with this on a national level, but there are also some local solutions as well. And I'm wondering if you can just spend a moment to talk about what's happening on the local level, and does that vary from one part of the country to another?
No, I think that's a great question. I think the statement that all politics is local can be applied to public health. I think all public health is also local. So, for example, in Philadelphia, there was an African-American surgeon at Temple who took it upon herself to form something called the Black Doctors COVID Consortium. And she and her friends and colleagues went into North Philadelphia, a primarily Black and brown community, and ultimately sat in people's living rooms and provided them with something they didn't have, which is a doctor they could talk to again and again and again. And with that, she was able to immunize 50,000 people in a community that was to some extent reticent about getting vaccines and getting tested. So I think that's an example of a local hero. And I just wish there were 10,000 Ayla Stanfords throughout the country.
Well, Dr. Offit, let me take that a step further, because we have been reading and seeing, and I've been watching firsthand in a number of these marginalized communities, there seems to be more distrust towards vaccines. Is that a fair assessment?
I think that understates it. I think that understates it. I think that what's happened during the pandemic is the opposite of what I would have imagined would have happened. I would have thought that vaccines would have been seen as what they are, which is the hero that is estimated to have saved about 3 million lives. I think the opposite was true. I think we now have a much greater level of distrust in public health agencies like the FDA, the National Institutes of Health, and the CDC. And I think it's because of a couple of things that happened during the pandemic. I think, first of all, in 2020, we didn't have anything. We didn't have antivirals till October of 2020. We didn't have monoclonals till November. We didn't have vaccines till December. All we had was to try and limit human-to-human contact for a virus that could be spread asymptomatically and kill you, right? I mean, anybody you pass in the street could potentially be shedding a virus that could kill you. So what did we do? We shuttered schools, we closed businesses, we restricted travel, we isolated, quarantined, masked, and I think we basically shut this country down. And people saw that, I think, as massive government overreach. Then the following year, 2021, when we had a vaccine by December of 2020, we mandated vaccines. And so you couldn't really go to your favorite bar or restaurant or sporting event or place of worship unless you showed your vaccine card. And that too was seen as massive government overreach. But, from the standpoint of public health people, you were 12 times more likely to be hospitalized, 12 times more likely to die if you didn't get vaccinated than if you got vaccinated. And our hospitals were overwhelmed. I mean, help us out. Please get a vaccine. And I think that also was seen as government overreach. Plus, we didn't get everything right. I mean, this was a novel virus. We learned as we went, and there were some things that we had said initially that ended up not being true. And I think that also helped perpetuate the distrust.
Well, you answered part of this just a moment ago, but when it came to basically shutting down offices and schools and places of worship during the onset of COVID-19, was that overreaction or was that the right approach when it comes to public health, not knowing when or where we would get the vaccine back in March of 2020?
Right. I think initially it was the right approach because if you looked at what happened during that year, every year, typically in our hospital, Children's Hospital of Philadelphia, by October, November, December, we are overwhelmed with influenza virus. We are overwhelmed with respiratory syncytial virus. Children come into our hospital, are hospitalized, or in the intensive care unit, and occasionally die. We saw none of that. We saw not a single case of influenza or respiratory syncytial virus. We basically stopped the spread of respiratory viruses. So you can imagine how much worse COVID would have been. So I think initially it was the right thing to do. I do think we shuttered schools for too long. I think we shuttered businesses for too long. But I think the initial reaction was the right one.
I'm going to get to the political debate in just a moment, but when it comes to vaccines, your message to parents, especially parents of infants and young children, when it comes to vaccines, your message is what?
To get them. Your job as a parent is to put your child in the safest position possible. And that's what vaccines do. They provide that safety. And I think that, my children, not surprisingly, were both fully vaccinated. They're older now. I now have 2 grandchildren, both of whom are fully vaccinated. And, when we vaccinate them, you never think they're going to get that disease. It's too horrible to think. But if you really want to pay attention to how important this is, just pay attention to some of these parent advocacy groups like Families Fighting Flu or Meningitis Angels or the National Meningitis Association. All those parents tell the same story. They've had a child who suffered or died from a vaccine preventable disease, and they all say the same thing. I can't believe this happened to me until it happens to them. So to not get a vaccine is to play a game of Russian roulette that maybe has 200,000 empty chambers, but it's not a game worth playing.
And so for the purposes of this conversation, I'm going to make you Senator Paul Offit. You're a public health expert, you're an author, you're a pediatrician. But if you were to ask questions to the incoming nominee for Health and Human Services, Robert F. Kennedy Jr., what questions would you ask him?
I'd ask him the following questions. 1, you have said on Lex Friedman's podcast in 2023, when asked the question, what vaccines do you think are a benefit? You have said that you think no vaccine is a benefit. Do you still think that's true? And if you think no vaccine is a benefit, will you in any way alter the CDC's immunization schedule? Or said another way, if you had young children today, would you vaccinate them? That would be one question. Another question I would ask is, you have written in your book, The Real Anthony Fauci, that you don't believe HIV is the cause of AIDS, that human immunodeficiency virus is the cause of AIDS. You have said that you think that AIDS was caused either by the antiretroviral drug AZT or by poppers, the so-called amyl nitrate that is a recreational sex drug. Do you still think that's true? Do you still think HIV is not the cause of AIDS? And if that's true, will you, as head of HHS, withdraw the use of antiretroviral drugs in people who have AIDS?
And so as you hear the testimony, we've had the chance to sit down with RFK Jr. He has said in the past that he is not anti-vaccine. He is a vaccine skeptic. From your standpoint, is there a difference?
He's not Robert F. Kennedy Jr. is not a vaccine skeptic. I'm a vaccine skeptic. I think everybody who sits around the table at the FDA Vaccine Advisory Committee is a vaccine skeptic. What Robert F. Kennedy Jr. is he's a vaccine cynic. He doesn't believe in data. So for example, if he says that vaccines cause autism, and then you show him study after study that shows that that vaccines don't cause autism, he doesn't believe that. If you show him clear evidence that HIV is the cause of AIDS, he still doesn't believe that. I mean, another question I would ask him is this. If you read his book, The Real Anthony Fauci, on pages 285 to 291, he says that he doesn't really embrace the germ theory, that he doesn't really embrace the notion that specific germs cause specific diseases and that those germs, like bacteria or viruses, are worthy of prevention or treatment. Does he still believe that's true? He also says that really to avoid infections, all you need to do is have a healthy immune system and avoid environmental toxins. So this is why he drinks unpasteurized milk, because he doesn't believe in the germ theory. It's all quite frightening.
Well, let me conclude with our opening line of questioning regarding the public health debate, because a number of studies, including from Pew Research, indicating that Americans are losing trust with the CDC and the FDA and other public health agencies within the federal government. What are your concerns moving forward, and what's your recommendation on this debate moving forward?
I think that this erosion of trust in vaccines is already having an effect. The Centers for Disease Control recently published a study in Morbidity and Mortality Weekly Report, their journal, showing that the percentage of parents who are choosing to exempt their children from vaccines is the highest it's ever been. It was like over 3.3%. That there were some jurisdictions where it was more than 5% of parents who had made that choice. And they said accurately in that report that we're losing herd immunity. And there's evidence for that. Last year, we had 5,000 cases of whooping cough. This year, we have 32,000. Last year, we had 3 outbreaks of measles that accounted for about 59 cases. This year, we've had 16 outbreaks of measles that accounted for more than 280 cases. Get to a couple thousand cases of measles, and we will once again see children die of measles in this country. I think that my plea to parents is, please consider that vaccines are probably the most important thing we do, because the problem, as you noted earlier, I think that the internet is a source of excellent information and also awful information that can cause you to make bad decisions for yourself and your family and put yourself and your family in harm's way. And we just have to keep fighting the good fight to get good information out there amidst this flood of misinformation.
Dr. Offit, for the research, literally writing the book on vaccines, and the work you're doing as a pediatrician, joining us from Philadelphia. We appreciate your time today. Thank you so much.
Thank you.